class, my name is Iris Serna and this is my demonstrative speech. Imagine, you are in the most beautiful, expensive, luxury, fancy restaurant enjoying a beautiful dinner with your soulmate. And then the person behind you starts to make strange noises. Suddenly, the person falls down to the ground. Quickly, you have a flashback and remember that in your speech class, a crazy girl talked about CPR. And you learn the steps to do it. What you gonna do? Option A. Continue with your expensive dinner. Option B. Be gossip like the other people in the restaurant. Or option C. Help the victim. Each year, over 350,000 out of the hospital car arrests occurs in the United States. The statistics prove that if more people knew the CPR steps, more lives could be saved. So, today we're going to learn what is CPR, we learn the acronym CAP, and we learn the CPR steps. Let's start by defining CPR. CPR means cardiopulmonary resuscitation. This is a life-saving technique useful in many emergencies in which someone breathing or heartbeat has stopped. CPR can help to bring blood flow to the brain and to the other organs until medical treatment can restore a normal heart rhythm. The American Heart Association uses the letter CAB to help people remember the order to perform the steps of CPR. But what does CAP mean? Okay, the letter C means compressions, the letter A means airway, and the letter B means breathing. Let's start by compressions. We're gonna push hard and fast on the center of the chest, like this, 30 times. We're gonna place our heel of hand in the middle of the chest and the nipple, and we're gonna place the other hand on the top and push down at least 2 inches 30 times, like this. 1, 2, 3, 4, 5, 6, and 30. Okay, the second is airway. We're gonna use the head, tail, chin lift maneuver, and we're gonna push on back on the forehead. Use the other hand to lift to chin forward, like this. Okay, and the last letter is breathing. We're gonna pinch the victim's nose to close and place our mouth into the victim's mouth, like this. And we're gonna give 2 breaths to the victim and watch the chest, like this. Okay, now we know what is the acronym CAP means. Let's see the steps to perform CPR. The first step, we're gonna make sure that you and the victim are in a safe place, like this. This is a safe place, okay? And then is the shake his or shake her shoulder and ask, "Are you okay?" And see if he or she responds to the call. If the victim doesn't respond, we're gonna check the pulse and the breathing. Okay, we're gonna shake the pulse with these 2 fingers and the carotid, like this. And the breathing, we're gonna place our hair on the victim's mouth, like this. if no breathing and no responding, we're gonna call the 911. And if we are alone, we first call the 911 and then start with the CPR. Okay, we're gonna put the person on his or her back in a firm area and kneel next to the victim neck and shoulder like this, and place the heel of the one hand over the center of the victim's chest and nipples, and place your other hand on the top. Keep your elbows straight like this, and position your shoulders directly above your hands like this. Okay, now we're going to use the CAP acronym, and did you remember it? Okay, the compressions. We're gonna use our body weight to push down at least 2 inches 30 times to complete at least 100 compressions per minute, like this. 1, 2, 3, 4, 5, 6, 30. Okay? And if you are not trained in CPR, continue chest compressions until medical personnel take over. If you are trained in CPR, go to the next step. Airway. After 30 compressions, open the victim airway using head, heel, chin, lift maneuver like this. Do you remember? And pinch the victim nose to close. Create a C shape or OK sign with your hand and place your mouth over the victim's mouth and give 2 normal breaths to the victim, and watch for the chest to rise as you give the breath like this. Continue CPR until there are signs of movement or medical personnel take over. If the victim responds, give a recovering position like this. We're gonna raise the hand to the top of the head, and we're gonna bend we're gonna blend this leg and this like this. Now we know the CPR steps, basis, and we have an idea to perform CPR. It is easy to help people following these simple CPR steps and the CAP acronym: 30 compressions, open airway, and 2 breathing. With this speech, I want to encourage you to take a CPR class and learn it in depth. You will be able to save a life of someone you love. Thank you for watching me.